Muchísimas gracias, doctora Alonso.
Thank you very much, Dr. Alonso. We have the panel on. I would like to now welcome Alessandra Ramos Maqueda. She's joining our panel. She's interpreter and translator from English into Portuguese. She has been working on law for the rights of trans people for 30 years, and she is the president of Transformar Institute. She's a member of Brazilian Coalition for Rights and the Latin American Caribbean Network and Afro-Latin Network. And this was the reason why we met with Alessandra. She's the coordination of community involvement of IMPREP study in Brazil. Welcome. Also, the panel welcomes Cesar Galindo from Guatemala. Cesar Galindo Arandi works for over 30 years in HIV on projects targeted to key populations in the context of higher risk in 5 Central American countries. Also, in the implementation of Sentinel Vigilance of CTS, he has participated in the preparation of national guidelines for the attention and prevention of HIV in the region, in the Central American region. Welcome, Cesar, and thank you for being here with us today. Also, welcome, Dr. Alonso, and thank you very much for your presentation. So much information. I believe this will guide this panel. I would like to start by thanking you in this context, the challenging context presented by Dr. Alonso, with significant percentages of reduction of care. What should we do in immediate term to change this situation? Alessandra, please.
Sim, então, eu tenho pensado aqui, no caso do Brasil, a gente foi extremamente afetado por conta da pandemia em graus diferentes, porque o Brasil tem uma região continental, e a gente conseguiu manter os serviços de telemedicina, que é uma boa notícia. A gente tem uma rede ampliada de serviços, a gente está ampliando o serviço à PrEP, que são o acesso à PrEP para a população, que são importantes, mas outros...
We have an expanded network, we have access to the population, it is important, but there are other structural barriers that prevent access to a poorer population, to Black population, and also, especially, access to the population of those people who, in Latin America, we have a problem that is trans population. This is not just a question of trans people. It's all the population, all trans population, because this is relationships, sexual relationships. All the population involved has difficulties to access health services in general, but also the more targeted group, the group more targeted to this sector, we still see something to be solved in America, that is social barriers, discrimination, things related to legal issues, the name. This has affected a lot to younger populations, LGBTI here in Brazil. Barriers of legislation also, and we have legislations, but this has to do with legislation for white population, different from younger or poorer populations. Usually it's Black population, LGBT population, they are the ones that are most affected. We can hear you. One of the most important aspects in the middle of the pandemic has been the capacity to be able to move. And this interaction that took place in some countries, precisely with the governments to respond, is what happened. What Mónica said, this is an opportunity on the community models that had a lot of importance last year. But as long as countries adapt to the situation of current pandemic, they are coming back to the previous models, unfortunately. But this capacity that the communities had to respond and to take the drugs to the further or distant locations, this has been very important. But another important aspect is delivery and also prevention programs, being able to favor access to tests, being able to send drugs to people, guarantee the supply of condoms, and to a certain extent also because of a question of access that Javier mentioned at some point is telemedicine. Telemedicine was able to cope up with the needs that people had. For example, in Guatemala, in the context of men having sex with men, the index rates are very high in population, and management has been quite a permanent challenge due to lack of response, sometimes from the authorities and the services that have been limited because of COVID, and they were not able to be to receive medical support, and probably this has had a good impact. Some organizations that work in the region were able to provide the services, but in a limited way because of the time restriction, closures of the countries, and also lack of resources. Universal service is also a permanent challenge. This means also an expense to provide resources to organizations. Many organizations in the region, in the context of Guatemala, they tried to serve their population, and a week later they had to close because there was a group that had to close because of COVID, because of lack of supplies, lack of response, lack of counseling or advice or technical support to efficiently manage biosafety. But I believe that we had to adapt, and we can work now, as Mónica well said, and this struck my attention because in a consistent way in Latin America, diagnosis was reduced around 35 to 40% in some countries. We see this in official reports. Many actions were implemented, and we need to continue with that. Thank you. Thank you, Cesar. And now I will concentrate on one of the comments that you made about the involvement and community services, to go back to Alessandra and ask her to comment on what the situation was in Brazil, how community services responded to the lack of provision of services by the government. Please activate your microphone.
A gente vive uma situação complexa no Brasil.
We live in a complicated situation in Brazil. In 2017, because we had a presidential election, the president is a negationist. He denies the situation. He has a certain negative attitude towards it. He has an attitude to go against the population. For example, the Ministry of Health, and the information was directly targeted to key population material was interrupted. They would not. Many images were removed. Many messages were removed. There was some information about men having sex with men, infections. All that was removed from the press. And especially, I would like to say that services were limited because of lack of physician to work on this. But the community network was kept. Community network among us did work, but we had to look for support, to look for help. And this has been discussed already. We had to look for help. We had to look for support. There was no planning for vulnerable populations, HIV, COVID services, and telemedicine was positive, I should say. But we had some difficulties depending on the place, which place in Brazil they would be found. There was lack of medicine and also some interruption because of fear. But it's important to say that these measures are not enough. A great part of the population in Brazil, they don't have internet, they don't have social distancing that is required. They live in shanty towns in extreme poverty, and we have a complicated situation. So we have some cases that are very serious because of the different barriers. There are structural barriers by now, mainly because of the economic situation. 23% based on research, 23%. I was saying, based on national research of infectology in Rio de Janeiro, found that 23% more of the population of LGBT has suffered compared to the general population as to the difficulties, economic difficulties, being able to work or being able to have health services. Thank you very much, Alessandra, for telling us about your experience from Brazil. The data that we saw in the presentation by Dr. Alonso was quite sad. Our region has gone back a lot as regards prevention, and as was mentioned in the previous session, even some countries are reducing for the next year their budget as to what is HIV response. What can we say here? What can we state or propose for the coming months, for a short time, for a near future, to respond and to take back the course of HIV response? Let me start with Dr. Alonso. Thank you. Well, I have been thinking about the topic that you mentioned about the assessment of funds or the availability of funds. Evidently, one of the logics is to ask for more funds. However, we have to look for strategies. We have to be more efficient and more effective. Also, we have to get on the truck that has the fuel. What I mean by this is integration at service level and also at civil society level. Civil society, HIV, hepatitis, tuberculosis. More integrated, we will be able to have a more impacting action and a more efficient action. Also, in order to be more efficient, governments will need to look for strategies, partnership together with the communities. This is absolutely clear, and something that we have not shown, but with pleasure I can share some data. The cascades of prevention, we can deaggregate them, we can divide them between services offered by the communities and services offered by the institutions. The ones by the communities have a higher impact. And this is something that was pending before, even in the past, but we want to be more efficient in this new scenario. This is one of the measures that we have to consider. I give the floor to you. Thank you. A great task, a great activity to link civil society and the state and the government. Cesar, please, we will listen to you now. Thank you very much. I believe that in line with what Mónica was saying and the experience that we live in Guatemala during the lockout, the great thing that happened here was the integration of just one speech, unified speech of all the institutions. This has not been seen in Guatemala in the last year. All populations gathered in one joint speech. We thought about the welfare of all the communities. This was very important because we lived a process that had not been lived since in the 90s, when all communities were expressing themselves. And I think this is very important, but we also have to add that data that Mónica is presenting. This is very important. If we have the data presented by Mónica about the populations as to prevention services, this is minimum, and what is being said is very important in all the contexts. This is not a problem with economics. This has to do with the emphasis on the cascading of prevention that is giving us many messages. And something true, there's some true that Alessandra was saying is we are not stopping no changes in the new infections. We have to work on that. And I believe that in front of a different aspect, we also need to mention what Mónica was saying about the role of the communities in Guatemala in 70% success, and the impact is huge. And this has their scope to have people who are in a difficult situation, well, to be able to reach them also. Thank you very much, Alessandra, for providing us this important information to keep strengthening the capacities from the organizations as well. I would like to go back on stigma and discrimination, the one that is gathering us all today. And I want to appeal to the experience that you three have, Alexandra in Brazil, Cesar in Guatemala. And I would like to ask you how you perceive from your experience the impact on stigma and discrimination. Cesar, please. Thank you very much. Well, the first aspect of stigma is oriented to the fact that usually we point at the people who are trying to have sex without condom. They are promiscuous people, people who live with HIV, or it will generate a bigger impact as to the state resources or the state-owned resources because of lack of drugs, because it's an expensive drug. Dealing with these situations with the communities, this has to be approached with. And a study that we organized with the university is that many people had difficulties, faced difficulties because of the fear for stigma that they had. On the other hand, we were facing service providers who it was very hard for them to understand the situation. It has been quite a big challenge throughout the years. For example, in the context of Guatemala, where at the beginning the organizations had difficulties because no organization of key organizations were not providing any support. The Ministry of Health was not providing any support either. It has been a process of work of a long time, many years. UNAIDS, they were the ones who positioned on the side of the organizations that were proposing this. If you allow me, these gaps have been closed little by little, but today, in the context of Guatemala and other countries in Central America, we are preparing our policies. El Salvador is working well, Honduras is working well, the same as Honduras and Panama. We can see an expansion in Central America for the next year. This will be a determining factor, and it will be led by us. But essentially, we need also a strategy by public policies. An important aspect in Guatemala is that right now, women have support in the country. There's 2 clinics that are giving support, and they're providing sexual work, women sexual workers. Also, they're providing services. Thank you. Thank you, Cesar. Alessandra, please. I would like to also motivate or know if there has been any impact to reduce the stigma and discrimination towards sexual diversity or people who live with HIV. Here in Brazil, PrEP was implemented with little resistance, but there is some fear, some initial fear, panic, of PrEP, but some research shows that the predisposition to take PrEP is after you have had the information on what this means. This is a big interest. There is a big interest. Here we have a network that is the expansion of the PrEP service, and think this is very good. And now we had expansion for complementary supplementary health, paid health services here in Brazil. Health professionals can prescribe PrEP, and also nurses who can even prescribe PrEP in Brazil. So we believe this will be essential because many times the medical community has some aspects, some issues being believing that PrEP is less important than TAR services or retroviral services for people who live with HIV/AIDS. So it is important that we can expand the service because we need to reach to other populations that are not reached. Black population, peripheral population, and trans people. Thank you very much, Alessandra. Thank you very much, you all, for joining this session and motivating this discussion. We have some pending activities to go back to HIV response that has been so much affected in the last 18 months. Now, we'll start with a closing session. Thank you very much again.
Hola, bueno, buenas tardes con todas, con todos y
Hello,
con todos.
well, good afternoon to everyone.
Queremos agradecer a
We
todos.
have reached the end, and we want to thank all the participants for on all the panels because it is way beyond the expectations we had as to knowledge, the passion, and all these who are present here. Okay, next one. Of course, I want to remind you, as we mentioned in the beginning, we would value your feedback. So we're asking all those participants in this forum to complete. You're going to receive a link to complete a post-meeting survey to continue improving these forums, and that way you will also receive a certificate of attendance to this forum. All this, of course, will be sent by email, and the incentive to complete our survey is, to receive the certificate attendance is that you have to complete the post-meeting survey. I want to point out again that I am so grateful to Lara and Lídice, who are the ones who made possible this meeting with a super intense work. And to Marco and me, it's been an honor to be with you. And thank you to Virology Education and all of you to be sitting here for 3 hours and sharing this forum on stigma and discrimination. Hopefully next year we can organize an event and see the results. Thank you to all of you.